Hello everyone, myself Dr. Parth Goswami, and let's learn about the thrombosis in the detail. It is one of the most important topic from the general pathology, particularly from the hemodynamic system. So it comes under the competency number PS 6.4 that include thrombosis, right? In which the student need to understand, normal homeostasis, etiopathogenesis of thrombosis, then morphology of thrombosis, difference between arterial and venous thrombus, and fate of thrombus, right? So we will cover each learning objective one by one, right? Long answer, short answer question, and MCQs can be asked from this particular topic, right? You can be asked in the exam that write down the difference between arterial and venous thrombus. You can be asked as a write down the morphology of thrombus, right? Pathogenesis also can be asked in a 5-mark question. And obviously for the MCQ, it is a most favorite topic. All right. So first of all, definition. What do you mean by thrombosis? So the thrombosis means a formation of solid mass in the blood circulation. Now, here I have written solid mass formation in the blood circulation. Now, what is the constituent of this solid mass, right? So, it is made up of platelet, fibrin, and the entrapped cellular elements of blood, right? It's because of coagulation system activation, there will be fibrin formation. And because of platelet activation, there will be platelet in the thrombus, right? So, solid mass made up of platelet, fibrin, entrapped cellular elements of blood is known by the name thrombus. The solid mass means thrombus, and the process of thrombus formation is known by the name thrombosis, right? All right. This thrombus formation, thrombosis, can be arterial or venous, means it can form either in the artery or it can form in the vein, right? Accordingly, the name is given. All right. Now let's see the etiopathogenesis of thrombosis. This is an image from the Robbins Book of Pathology, very well illustrated. See, thrombosis basically develop in our body because of three main reasons. Remember that three main reasons. One reason is endothelial injury, right? Second one is because of endothelial injury, procoagulant activity will be increased. Second one is abnormal blood flow, which allow the cells to come closer to the endothelium and will lead to thrombosis formation, right? And the third cause is hypercoagulable state in our body. These three are the main reason. Among that, most important cause is endothelial injury. And these three etiology for the development of thrombosis is known by the name Virchow's triad, right? It's a most important MCQ. All right. So first of all, before we understand each of these factor one by one, you need to understand the basic property of endothelium. So the endothelium in our body, endothelial cell will line the blood vessel, right? So the endothelium is having a both thrombotic as well as anti-thrombotic property, right? There is a balance between these two property. I want to say that whenever endothelium is injured, the endothelium is activated and they will do the coagulation. And suppose the clot is formed in the blood vessel, then endothelium activated, that will lead to anti-thrombotic action, right? So whenever needed, accordingly endothelium will adjust, and they have the both property of thrombus formation as well as prevention of thrombus formation, right? So if endothelial is injured, this balance is disturbed, and so thrombosis can occur. So first of all, let's see the anti-thrombotic property of endothelium. So endothelium secrete prostaglandin I2 and the nitric oxide, which will prevent the platelet binding to the endothelium. We know very well that whenever the clot is formed in our blood, it is made up of two things. First is primary hemostatic plug, that is made up of platelet, that will be mediated by platelet. And then after coagulation system is activated, and they will lead to secondary hemostatic plug formation by fibrin. Primary plug is weak, that's why body need to produce secondary hemostatic plug by activation of coagulation system. And this platelet binding, primary plug formation, hemostatic plug formation is prevented by these two factors. All right, endothelium can secrete heparin-like molecule which will bind with antithrombin 3, and so it will inactivate the thrombin factor number 9, 10, 11, and 13. So it will prevent the coagulation. Endothelium can secrete thrombomodulin, which will activate protein C and S, and protein C and S having the action of cleavage of factor number 5, right? So because of cleavage of factor 5 and 8, by this way they will prevent the clot formation. So thrombomodulin activate protein CNS, which will lead to cleavage of factor 5 and factor 8, right? All right. Then tissue factor pathway inhibitor will prevent the thrombosis. And finally, by plasminogen activator, fibrinolytic system can prevent the clot formation, that is mediated by plasmin, right? So fibrinolytic system will also prevent the thrombus, which will be secreted by endothelium. All right. Now, which are the prothrombotic property of endothelium which lead to thrombus formation in abnormal condition? So that is, one is ADPase. It will degrade the ADP, and so that platelet can aggregate with each other, because the ADP, adenosine diphosphate, is a platelet aggregating agent. So they will help in clot formation, thrombus formation. Tissue factor secretion can lead to activation of extrinsic pathway of uh, coagulation cascade, right? Then endothelium can secrete the inhibitors of plasminogen activator that can lead to antifibrinolysis, right? So endothelium can act as a fibrinolytic system as well as antifibrinolysis. They can secrete the factors that will inhibit the plasminogen activators. They can secrete a von Willebrand factor that is also having prothrombotic property. So now you can understand that if balance of prothrombotic and antithrombotic property of endothelium is disturbed, then thrombosis can form. So endothelial injury is the most common cause of thrombus formation. It means a change in a blood vessel. And endothelial injury can be in the form of two types. One is physical endothelial injury, and second one is endothelial dysfunction. All right. So first, let's see how physical endothelial injury occurs. So that is by, in case of a myocardial infarction, it can occur in case where the lipid get accumulated in the tunica intima of blood vessel. That is a atherosclerosis, right? Intimal thickening will be there. That can lead to endothelial injury. Vasculitis, which is inflammation of blood vessel, can lead to endothelial injury. Aneurysm means dilatation of blood vessel, can lead to endothelial injury. And the disseminated intravascular coagulation, that is a most dangerous factor, can aggravate the endothelial injury. Infective endocarditis, endocardial infection also can lead to endothelial injury. Heart valve damage can occur in rheumatic heart disease and congenital heart disease. It is also one of the cause of thrombus formation. And last one is SLE-induced Liebman-Sach endocarditis. Autoimmune disease like that of systemic lupus erythematosus also can lead to inflammation of the inner layer of heart, right? All right. And non-bacterial thrombotic endocarditis, hypercoagulable state in our body can lead to endothelial injury and the thrombus formation. All right. Second one is endothelial dysfunction. Now here there will be no direct endothelial injury, but endothelial surface is become thrombogenic. It will dysfunction. It will become thrombogenic, so that it's abnormally adhesive to the inflammatory cell. They will favor the clot formation. That's by endothelial dysfunction. The endothelial surface become thrombogenic. Hypertension, turbulence of blood flow, bacterial toxins, cigarette smoking, radiation, hyperhomocystinemia, high cholesterol level in the blood, all that factor can lead to endothelial dysfunction. All right. See, this is the image from the textbook of pathology by Dr. Hers Monser. See, it's very well demonstrate activation of coagulation system. See, this is the primary hemostatic plug on the left side. Whenever endothelium is getting injured, platelets are activated, because of exposure of subendothelial collagen, right? So platelets are activated. This pink dot are the platelet. So they will get activated and they will, form a primary hemostatic plug. But this plug is very weak, right? That is not formed. So if the endothelial injury persists, then secondary hemostatic plug can form by activation of coagulation system, and it can be activated by the extrinsic pathway or intrinsic pathway. In the extrinsic pathway, tissue factor 7 plays a main role, while in the intrinsic pathway, main factors responsible are 12, 11, 9, and the 8 one. So activation of these all factors finally will lead to activation of factor number 10, which will activate it, and they will activate prothrombin to get converted into thrombin, which will convert the fibrinogen into fibrin, and this fibrin will form together with platelet, they will form a secondary hemostatic plug, which is a very form, right? And they can help in prevent the bleeding. But when it is abnormally activated, this system, both system, platelet coagulation system, abnormally activated, they will lead to thrombus formation, and which will not get easily detached from the blood vessel. All right. Platelet is also having role in thrombosis formation. Platelet activation involves the three steps. First, platelet will adhere to the endothelial surface by GP1B receptor. Then they will secrete the secretion from their granules, and finally they will get aggregated together by the receptor GP2B and 3A. So adhesion, secretion, and aggregation are the sequential step of platelet activation, which will help in formation of hemostatic plug. All right. Now, the second factor for development of thrombosis formation, if you remember, then it was the abnormal blood flow. If the blood flow is getting disturbed, then it is known by the name turbulence of blood flow. And if it is slowed down, right, in the inflammation, it gets slowed down. as we have discussed. So that is the stasis of blood. So because of abnormal blood flow, thrombosis can occur, and it can occur in case of a myocardial infarction, arrhythmia, then atrial fibrillation, then dilated cardiomyopathy, aneurysm, ulceration in the atherosclerotic plaque, then polycythemia vera, right, which is a myeloproliferative neoplasm, and varicose vein, and finally sickle cell anemia. All these disorder can lead to abnormal blood flow, and which will help in thrombosis formation. All right. Third factor for the development of thrombosis is hypercoagulability. So, hypercoagulable state in our body is known by the name thrombophilia. It's a systemic disorder that is associated with increased tendency to develop thrombosis. In this condition, hypercoagulable state in the thrombophilia, our body have more tendency to form a clot in the blood, to form a thrombus in a blood. All right. So see, this is the table from the Robbins book of pathology, right? The cause could be primary or secondary. Primary cause means genetic, that is present from birth, in which you can do nothing. But secondary cause are the acquired one, that acquired later on in the life. So which are the genetic cause that will lead to thrombophilia, abnormal tendency for the thrombosis? So the most common genetic factor that will lead to thrombosis formation is factor number 5 mutation. Factor 5 plays a role in it will plays a role in protein C and S, will help in cleavage of factor number 5 and 8. So if your factor 5 is mutated, then they will abnormally resistant to the action of protein C and S. If factor 5 is mutated, then protein C and S cannot do the cleavage of that factor 5, which will lead to thrombus formation. If the coagulation factor not cleaved, then thrombus formation can occur. And the factor 5 mutation is known by the name leading mutation, right? All right. The second genetic factor lead to thrombus formation is prothrombin coagulation factor mutation, known by the name G20210A, right? Third one is that sometime, there could be increased level of coagulation factor, particularly of factor number 8, 9, 11, and the fibrinogen. Genetics is unknown for that. Rarely, genetic disorder that can lead to thrombus formation is antithrombin 3 deficiency, protein C and S deficiency, and homozygous homocystinuria, right, and the fibrinolysis defect. All these can lead to rarely they can lead to thrombus formation. The reason very well. If protein C and S is deficient, then factor 5 will not get cleaved, and so thrombus formation can be there. So that was a genetic factor. Acquired factor for the thrombosis development, there is a strong risk factor for the thrombosis if any of these factor is present. For example, if the patient is on prolonged bed rest, prolonged immobilization, like in certain fractures, in certain multi-organ dysfunction in which patient cannot walk, right, myocardial infarction, atrial fibrillation, surgery, prolonged fracture, burns, cancer patient, prosthetic cardiac valve, disseminated intravascular coagulation, heparin-induced thrombocytopenia, antiphospholipid antibody syndrome. All these conditions are a potential risk factor for the thrombosis formation, and that's why in all these factors, it's advisable to give oral anticoagulant drug for the clot for prevention of thrombosis, right? Other risk factors include, hyperestrogen, nephrotic syndrome, oral contraceptive use, sickle cell anemia, and the smoking. These are the less important risk factor, right? These are the main one, above one. They are the strong risk factor for the thrombosis. All right. So as we have discussed, the thrombus formation is of two types. Either it could be arterial or it could be venous. They can form in the artery or in the vein. So what is the basic difference between the arterial thrombus and the venous thrombus? So this is the most important. Kindly listen it carefully. So the main etiology for the development of arterial thrombus is endothelial injury, while the main etiology for the venous thrombus is stasis of blood. Main site for the development of arterial thrombus is aorta, particularly coronary artery branch, right? It can also form in cerebral artery, iliac artery, femoral, renal artery, and the mesenteric artery. And accordingly, it will lead to, ischemic coagulative necrosis in affected organs. Suppose there is a thrombus formation in the coronary artery, then it will lead to ischemic coagulative necrosis in a heart, which is known by the name myocardial infarction, right? So the thrombus and infarction are interlinked with each other. If the block is in the cerebral artery, then it can lead to brain infarction, right? So, they are the cause of infarction. All right. Venous thrombosis is common in superficial varicose vein of leg, deep leg vein, popliteal vein, femoral, and iliac veins of the leg, right? So, if thrombosis develop in the leg area, Then, from the deep leg vein, the thrombus can travel to the pulmonary circulation and it can lead to pulmonary embolism, right? Which can be, sometimes life-threatening. So that is the importance of venous thrombus, in which the calf is become red, painful and tender. Hormone sign is positive. If you dorsiflex the leg, then there will be strong pain, right? All right. Rate of blood flow is very rapid in arterial thrombus. In the artery, blood flow is very rapid, while here the blood flow is sluggish. That's why the thrombus is formed there, right? Arterial thrombus is mural. Mural means it is adhered to the wall of the artery, right? It will attach to the wall, mural thrombus. While the venous thrombus is totally occlusive, it will occlude the affected vessel. All right. The main etiology, main thrombogenetic factor for the development of arterial thrombosis is atherosclerosis that will lead to endothelial injury, right? Most common factor nowadays, because of smoking habit, because of high cholesterol, because the patient is not taking drug for hypertension. Atherosclerosis is very common and it will lead to endothelial injury and ultimately infarction. Uh, you know, Venous thrombus main thrombogenesis factor is prolonged operation, childbirth, like that of case. Venous stasis, that is the main cause. Okay, grossly affected organ in the arterial thrombus will be gray-white color. The infarction is white color, and it's a friable. This thrombus, arterial thrombus, is friable with presence of line of chain over the surface. What is line of chain? So in the arterial thrombus, it is, if you do the microscopy, it is made up of platelet fibrin and admixed red blood cell. So there is an alternate band of RBC and white, alternate band of white and red color. White color is because of platelet and fibrin, and the red color is because of RBC. So that is the line of chain that can be seen over the surface, right? Line of chain also can be seen in venous thrombus, but not prominent one. It's mainly red color. Red color is very prominent, because it contains lots of RBC. Venous thrombus is usually congested, lots of RBC is present. And as we have discussed, because of arterial thrombus, the effect is infarction in the affected organ. While here there will be embolism, right? From the deep vein thrombosis, it will travel to the pulmonary circulation, and that is known by the name pulmonary embolism. So the main effect in venous thrombus is embolism, while main effect in arterial thrombus is infarction. All right. Uh, in the pharmacology, you might have learned that aspirin prevent the arterial thrombus formation, and the heparin and warfarin will prevent the venous thrombus formation, right? So we can prevent the thrombus formation by these drugs. There are lots of new drugs are available, like that of apixaban, dabigatran, all that can help in prevention of the thrombus. They are the new anticoagulant drugs. All right. And in the arterial thrombus, there is a less chance of embolism. All right. Now, very important Viva question as well as sometimes can be asked in a MCQ. What is the difference between the antemortem and postmortem clot? Now, what is the meaning of antemortem clot? Antemortem clot means the clot or thrombus that form in a living circulation, in the living human being. If the clot is formed in our body, clot or thrombus form in our body before death, then it is antemortem clot. While the postmortem clot means, the thrombus or clot, it is known by the name clot, not thrombus. A clot form after death, that is known by the name postmortem clot. You know, so let's see the difference in the antemortem clot that form in the living human being. It will attach to the vessel wall. It's a form and focal attached to the vessel wall, while the postmortem clot is not attached. Because if you do the autopsy, it will lead to medical legal issue. If you do the autopsy at that time you found the clot in the vessel, then you need to identify whether it formed before death or after death. So if it is before death antemortem, then it is formed and attached, while in the postmortem it is not attached. Consistency in the antemortem clot is dry granular form and very friable, while here it is gelatinous, soft and rubbery. Line of chain obviously present in antemortem clot, it is absent in postmortem clot. So, appearance of antemortem clot is by line of chain, alternate white and dark area is seen. But the postmortem clot is having very characteristic appearance, because of gravity. In the dependent portion, in the lower layer, it is made up of red blood cells. So there will be dark red color, which look like a currant jelly over the lower layer, while the upper layer having the yellow-white color because of coagulated plasma. And it gives a chicken fat appearance. So that is the appearance of postmortem clot. Upper layer is chicken fat yellow color, while the lower portion is red color because of RBC. All right. Now, one very interesting question, what is vegetation? We will discuss the vegetation in our cardiovascular system discussion, but what is the meaning of vegetation? So, vegetation means thrombus formation over the heart valve. The cause are mainly four: rheumatic heart disease, non-bacterial thrombotic endocarditis, infective endocarditis, and the systemic lupus erythematosus, right? So we will discuss vegetation in detail in our systemic pathology. All right. Now, once the thrombus form in our body, what will happen to that? Because if it is not getting treated, then it can lead to blockage of the blood supply to the affected organ, and patient can die. So fat of thrombus, once it form in our body, could be of four type. That is very beautiful diagram given in the Hers Mohan book, right? See, there are four fat. One is resolution, organization, third one is propagation, and thromboembolism. First, we will see resolution. That is the ideal outcome, right? Fibrinolytic system is activated. Whenever clot form in our body, endothelium will secrete fibrinolytic materials. Fibrinolytic system as well will be activated, right? So once they are activated, plasmin will form and it will dissolute the thrombus. Plasmin will dissolute the thrombus. It is not seen in large thrombus. Resolution seen only in the small thrombus mainly. And suppose if, for inducing the resolution, you can give the therapy, thrombolytic therapy in the form of streptokinase or urokinase, right? It will help in dissolution of the clot. So see, this is the resolution. It is not attached to the endothelium. It will resolute, you know. All right. So that is the ideal outcome we want, right? But sometimes, thrombus will not get resolution and it will organize. What is the meaning of organization? Means the thrombus will not remove. In the resolution it is removed, but here it is not removed. And phagocytosis keep on increasing. There will be keep on increasing granulation tissue. There will be ingrowth of fibroblast, endothelial cell, and smooth muscle. So all that will lead to more and more thrombus formation in the affected vessel. It will organize the vessel, right? Finally, it will occlude the vessel, right? It form a part of vessel. It will organize within the vessel. It will form a part of vessel. All right. Sometimes thrombus can be dislodged and propagate to the other area, right? Accumulation of additional platelet and fibrin. So it will finally completely obstruct the vessel. Vessel can be completely obstructed by platelet and fibrin accumulation, right? So that is the propagation, not traveling. Propagation means it's a obstruction of vessel because of accumulation of more platelet and fibrin. But sometimes thrombus in the early stage can be dislodged and can travel to the other area of our body. That is known by the name embolism, thromboembolism, right? The thrombus can be friable in the early stage, and so it might detach and lodge into the other side, right? That is thromboembolism. From heart, suppose it spread to the liver or brain, then it is thromboembolism. All right. So that was all about the thrombosis, right? We have discussed the definition, morphology, pathogenesis, difference between arterial venous thrombus, and finally we have seen the fate of thrombus. Now let's see MCQs. So, which of the following have the major role in the thrombus formation? Endothelial injury, vasoconstriction, coagulation system activation, platelet activation. All factors are important, but the most important one is endothelial injury in the Virchow's triad. So the answer is endothelial injury. Which of the following does not present with recurrent thrombosis episode in the upper limb? Prostate carcinoma, pancreas carcinoma, osteosarcoma, or AML? So the answer is osteosarcoma. The rest of the three malignancy can lead to thrombus formation, right? These cancers are associated with thrombus formation: prostate carcinoma, pancreatic carcinoma, and acute myeloid leukemia. 23-year young male developed thrombosis in a multiple organs. On detailed coagulation study, his factor V is mutated. Which is the name of this particular mutation? So the factor V mutation is known by the name Leiden mutation. So answer is very simple. Leiden mutation. Case type of MCQ: 32-year male developed pulmonary embolism. On physical examination, leg calf region swollen and red with much pain. What could be the type of embolism? So as we have discussed, it's a thrombus in a deep leg vein. That's why the calf region is red and swollen, and it can travel to the pulmonary circulation and lead to pulmonary embolism. So the answer is venous thrombus, right? The thrombus is in the deep leg vein, right? It is not arterial thrombus. Remember that pulmonary embolism is an example of venous thrombosis. All right. So that was all about the thrombosis. Hope you have enjoyed this very important video. I will be right back with a new video. Till then, take care and bye bye, and keep watching videos and do subscribe the course. Thank you very much. See you soon.